back to the East Health TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, comment, share, and subscribe. And please do come back for more. See you
So,
soon.
you've been diagnosed with uterine fibroids, or maybe someone you care about has, and suddenly your head is just swimming with questions and a whole lot of uncertainty, right? It's an incredibly common thing, but we're going to clear up the confusion today. Okay, let's just dive right in and tackle the biggest fear first. It's the first thing that pops into most people's minds when they hear the word tumor. And I've got some really great news for you. That fear, it's largely a misconception. Let me be perfectly clear. Uterine fibroids are not cancer. They are benign growths. It's extremely, extremely rare for one to become cancerous. So let's all just take a collective breath and move on with the facts. So, if they aren't cancer, then what exactly are we talking about here? To make any kind of informed decision, we've got to start with a solid understanding of what fibroids actually are. It's really that simple. They're just non-cancerous growths of muscle tissue that come from the uterus. And look at that age range. They are super common during a woman's reproductive years, which is exactly why this is such an important topic for so many of us. Now, while doctors don't know the single exact cause, they have found some pretty clear links. Things like your age, your family history, diet, and even race can play a role. Understanding these factors helps us see who might be a little more susceptible. Okay, here's where it gets really interesting. Not all fibroids are created equal. You know the saying in real estate, location, location, location? Well, it's kind of the same thing here. Where a fibroid grows makes a huge difference in what symptoms you might have. Let's break down the four main types. First up, the most common kind, intramural. A good way to remember this is intra for inside and mural for wall. These guys grow within the muscular wall of the uterus itself. Because of that, they can sometimes cause heavier periods or make your womb feel larger. Next are subserosal fibroids. These are on the outside of the womb. And since they aren't inside messing with the uterine lining, they usually don't affect your bleeding. Instead, symptoms often come from them pressing on other organs nearby, like your bladder. Then we have submucosal fibroids. These are the ones that grow just under the inner lining of the womb. And because of exactly where they are, this is the type that's most often linked to heavy bleeding and, for some, challenges with getting pregnant. And finally, we've got pedunculated fibroids. These are pretty unique. They grow on a little stalk, almost like a mushroom on a stem. They can be inside or outside the womb, and they're known for causing a sharp, sudden pain if they happen to twist on that stalk. Ouch. All right, so we know the different types, but what does this all actually feel like? How would you even know you have them, and how do doctors go about confirming it? You know, many women have absolutely no symptoms at all. But for those who do, these are some of the most common signs. It really all depends on the size of the fibroids, how many there are, and, like we just talked about, their location. Getting a diagnosis is usually pretty straightforward. Sometimes they're found during a routine pelvic exam, but the go-to tool for confirming them is a simple pelvic ultrasound. If things are a bit more complex, a doctor might want an MRI to get a really crystal clear picture of what's going on. And this brings us right to the heart of it all, the central question. You've got a diagnosis. So what's next? Is treatment automatically the next step? Let's just put it out there one more time because this answer is so important. No. It is that clear and that simple. Not all fibroids need to be treated. And this is a huge point, one that can relieve so much anxiety. The decision is incredibly personal. So how do you and your doctor decide? Well, it really comes down to two different paths. On one hand, if your fibroids are small, you have no symptoms, or you're getting close to menopause when they often shrink on their own, your doctor might just suggest watchful waiting. On the other hand, if your symptoms, like heavy bleeding or pain, are really affecting your quality of life, that's when the conversation about treatment really starts. And if you and your doctor do decide that treatment is the right way to go, it's not a one-size-fits-all situation. There's a whole range of options to think about, all based on your specific case and what you want for your future. First up, medications. Now, it's important to know that most of these are designed to manage the symptoms, like the heavy bleeding or pain, not necessarily to make the fibroids disappear, but they can be a really effective first line of defense. If you're looking at a surgical approach, there's a myomectomy. The key thing to remember about this procedure is that it removes only the fibroids, leaving your uterus intact. This makes it a primary option for women who hope to have children down the road. On the other end of the surgical spectrum is a hysterectomy. This is the removal of the entire uterus, and it is the only guaranteed permanent cure for fibroids. The crucial trade-off, of course, is that it also ends your ability to get pregnant, so it's a decision often made by women who are sure they're done with childbearing. All of this information is really meant to empower you. Understanding the basics, the different types, and your options puts you in the driver's seat, ready to have really productive conversations with your doctor. And while watchful waiting is common, there are definitely some red flags. These are the kinds of symptoms that mean you should get medical care right away. Things like severe bleeding that could lead to anemia, intense pain, or feeling weak and dizzy are signs you absolutely should not ignore. We have covered so much ground today. The goal isn't just to throw answers at you, but to help you ask better questions for yourself. Because when you're armed with
Please subscribe.